We are live. Anybody here yet? Nope. Hello, this is Dr. Dan. I'm here with Allie. She's our awesome office assistant here, and she's had like a cold with like allergies or what?
Allergies, cold with sinus stuff, and some congestion in the chest.
You think you had a sinus infection?
Maybe. Hope not.
So she's got allergies, cold, possible sinus infection, and she's been taking herbs, decongestant, and what else?
Vitamin C.
Vitamin C.
Essential defense.
Essential defense. We'll go over that in a little bit. She got a Juice It shake today for us to fight the colds and allergies. So shout out to Juice It and their immune booster. And if Juice It's watching, and so we're just gonna go through a treatment, and then I'm gonna talk a little bit about some supplements, and then you can ask me any questions that you would like. All right. So, Allie, you can lay on your stomach. That. So my head gets cut off a little bit on this, but you get to see the treatment well with Allie. So first of all, I always use, we're gonna do a full body treatment to get everything, your whole nervous system stimulated and muscles calm down when you're coughing a lot. You get a lot of tightness and stiffness in the upper back and neck. It also causes increased pressure in the lower back. So that's why you get achy throughout your whole body when you're sick. So we're gonna start out with just doing a little vibropressor. We call it medical muscle therapy or manual muscle therapy to get the muscles loosened up. And this also will help her cough a little bit. This will stimulate her thoracic spine, and that the nerves in the thoracic spine innervate the lungs. And that will stimulate them probably to cough when they're irritated already. And that will help her get some of the mucus out of the lungs. Yesterday, she started on some herbs called Pieria. They're a Chinese Oriental herb complex that we sell here. It's good for like pretty significant allergies, and when you're starting to get like a sinus infection with congestion where you have like redness or pain or coughing, when the cold becomes a little bit more advanced. The herbs are great. It's better than taking antibiotics because those mess up your immune system by screwing up your stomach. 90% of your immune system is in your stomach. Well, 70 to 90%. It's a little tight right here. Is this tender?
A little bit.
A little bit. She's tight on the left side of her back here. Just work that out. A little tight on the right side, not as bad. Any pain in these joints?
Yeah, right there.
Right side, right there. How about down there? Does it go into the glutes?
A little bit.
A lot of times we get pain in the lower back and the glutes. You get radiating pain, or issues in the lower back nerves. You get pain that radiates into the glutes, and when it gets bad, it goes down the leg. It's one of the most common things we treat in the office here. Got a couple viewers. Hey, everybody. Can't read your name from my screen, but ask a question, we'll get to you. Type it in the comments section. Just a little tight in the glute muscles here. So Balance Chiropractic, we don't rush through treatments. It's not just come in, get cracked, and go away. That's what a lot of chiropractors do. We work on the muscles. As the muscles get tight, all the muscles are attached to bones. The muscles spasm up, then your joints will be compressed, causing pain and irritation to your nerves. And if nerves get irritated, then all the different systems of your body will get irritated. It can cause symptoms such as colds and stomach ache and low back pain, nausea, dizziness. Right side is a lot tighter than the left. And we'll work into the glute here. Get out of the way of the camera. I'm new to being a Facebook superstar in this video thing, so bear with me. So we'll treat the glute medius here, just real tight on this left side. A lot of times that means it's compensating for the right lower back. Now let's check the hamstrings because they attach to your pelvis. And if the hamstrings are tight, that can throw your pelvis out of whack, either causing it to extend or flex, and that can cause low back issues also. Everything's attached. And I have called a flexion distraction table, so I like to stretch everybody out a little bit. Most chiropractors don't have this. So let's see if I can get out of the way of the camera here. So we're just stretching lightly at the lower back and trying to get a little bit of a release. This also feels good because lower back is what's compressed the most of the time. And then I usually start out with drop piece adjustment. Drop piece adjustment is just where you bring the table up like this and if we push it down, makes a sound. It doesn't hurt at all, but it helps us get real specific on joints in the lower back and pelvis. And it's easier on the chiropractor than side posture, but we'll show you that too. So we'll go here on the right side, just adjust that. Out of the alley. Good. Good. A little bit in front of the camera. Then we're going to come up here. We're going to do manual adjustments in the thoracic spine and base of the neck here. So take a deep breath in and out. Good. And this is where you get bound up when you're coughing a lot, which she has been. See, that just stimulated her lungs and helped her cough, get up all that phlegm and things like that. And then I will have her lay on her back. We'll adjust her neck and we'll work on her sinuses and drain her lymph nodes a little bit. All right. So this way. So a lot of times when you have a cold, like you have a lot of lymph and mucus that build up in the neck, and then your sinuses get congested. When your sinuses are congested, that means that you can't get that fluid to release. So what we do is we adjust the neck and then strip out the lymph nodes on the side of the neck, and that helps things start draining more. And we'll also work a little bit on the top of her base here to get her sinuses draining a little bit. All right, so check your neck out. We'll tie on the right side, especially up at the top here. Again, when you're coughing, your muscles or your neck gets really tight because the muscles that help you cough are all in your lower neck, upper back. Bring your head to the left here. We'll just adjust it. Good. We'll go this way. Good. And then, how'd that feel? Good. Then I like to just traction out the vertebrae a little bit. Just really tight as that tender up here. Like to work the muscles out at the base of the skull. That's what causes people to get headaches quite a bit. Pretty tight there. Do you have any headaches?
Not in the last few days, no.
Okay. Oh, one more here. That's really tight. One more on this side. Sorry. Be tender too. Try to just get that to calm down. Get tender.
Yeah, kind of.
Take a deep breath in and out. And in again. So now I'm just doing a release to the base of her skull, the muscles, get them to come down a little bit. That's just tighten her. Breathe in again.
What's that?
Breathe in again. Then out. Now again. Good job. So now I like to strip out the lymph nodes a little bit, like I was talking before. And we'll just turn the head to the side. If your kids are sick, you can do this to them too. Right down like your SCM or this muscle right here. On each side, you can just massage. And that helps them kind of drain their sinuses. Any drainage there?
I mean, yeah,
A little bit.
that's good.
And then you massage right down above the collarbone. That helps it drain more. Then we go to this side. You can see that she's it's a little bit swollen and clogged up over here. Is that tender?
Mm. Yeah, I felt it more on the right side, the ear and in the.
Yeah, it's like all up here, so I'll do that too. You can do a little ear adjustment. Zoom up a little bit. Bet you guys didn't know we could adjust ears. We can. Spectacular like that. And then we can also work on the sinuses. Just applying some pressure to the face. Feels really good usually. Helps them drain. There's a couple other techniques that I use to open up the sinuses. Distraction of the nose here. How does that feel?
Weird.
Weird. Usually you can feel a little drainage or a little pressure
It
being
feels like
released.
it's like opening up. A
Yeah, in the sinuses.
Mm-hmm.
You take a breath in and out. These are Jones strain counter strain techniques. They're kind of painless techniques, but they really help. And then we're gonna squish your face. This one feels really good too. No, it looks weird. How's that feel? You feel like it's releasing a little bit in there?
Not yet.
Not yet. It'll take a little while. Breathe in, and then out. Breathe in again, and out. Good. Oh. How'd that feel?
Good.
Good, and that's just that's one treatment we can do. One of the treatments we can do to like boost the immune system and get the lymph draining and mucus out of the face and like just help you feel a little bit better throughout the cold season. I'll talk a little bit about some supplements here, and then we'll be done for the day. Thank you for your help, Allie.
Mm-hmm.
Anything else you need?
No.
Nothing else?
Good.
Okay. Your Facebook superstar.
Thank you.
You're welcome. All right. Hello, Sarah. Any questions I can answer for you? All right, let me get positioned here with this camera. So I'm gonna go through a couple supplements here that are helpful for the cold and allergy season. First thing you want to start out with is a good I would call them like a defense herb so you don't get sick. Like one of the ones that we go to a lot in the office is called Essential Defense by Nutridyne or Dynatronics. They're prescription-based, or not prescription, prescription strength supplements that only chiropractors or healthcare practitioners can buy. But we sell them here in the office, or if you email me on our website, we can get them mailed out to you also. We have a little shop on the website that we started for people that aren't in the area. So if essential defense, you start feeling like you're sick, you start taking about 2, like you can take them up to like every 20 minutes until you start feeling better, and then you start like taking them every like 40, 60 minutes. An herb is more like a food, so you don't have, so you do take more than like a medication. Medications are exceptionally stronger, and that's why we get side effects from them, because they're not natural to the body, and it can throw us out of whack, like because we go from one place in our body all the way to another place, and it has to catch up, and our systems aren't very well adapted to handling that. The next thing I would recommend if you have allergies is I do some acupuncture, and I also sell some herbs for specific things that people come down with here. But like a Magnolia Clear Sinus by Evergreen Herbs. Sorry, I'm trying to get this camera angle right. By Evergreen Herbs, it's like a natural antihistamine. Take it about 3 times a day, 4 capsules, depending on what's going on with your sinuses and allergies. But it's a natural antihistamine, which is a little bit easier on your body than the regular antihistamines that you get over the counter. And if you have bad allergies, you can also add this to your allergy regimen to help calm those down. Like I take all of these supplements like most of the year because I'm allergic to just about everything in Fargo, North Dakota. It's really windy and it's dusty and it's in a valley, so we get all the blowing of the mold from the river, dust and dirt from the fields during harvest. Just basically anything from hundreds of miles. So it's a real big allergy city, and a lot of my patients suffer from allergies. So we supply them with these different herbs, and it helps them get through these different seasons. So the next thing is if you have congestion, like pressure in the face, or if you have a lot of drainage in your system, you start getting cough like Allie, you want to start on like a decongestant. And if you want to do it, you can do it over the counter with like a pseudoephedrine or something like that. But we recommend like starting out with something easier on your system, because like when you're sick, you don't want your body working overtime and getting run down. That can happen, and these colds and coughs can hang on for weeks and weeks without clearing up because your body is just run down so much. So the next thing we do is for decongestion is Nasal from again from Dynatronics. Here it is, like that. We take 2 about every 3 to 4 hours, like you would eat. That helps you metabolize it. And if you have like anxiety or you're sensitive to stimulants, this is a very good a decongestant to use, because it's not as intense. It's like Sudafed, and it's not manufactured. It's all natural, and it's not synthetic, so it's a lot easier on your body. So I'll take that when I get congested. The next thing, if you got a cold already, if you've been sick for a week, you're starting to get redness in the sinuses, pressure in the face, like starting to get phlegm that's yellowish, like you're heading towards that sinus infection, then I recommend this Peoria Clear Sinus. Started Allie on this yesterday, and she's starting to feel better. You can start out when you first get it, like taking up to like 4 every hour until you start feeling better. Then you start making the lengths of time that you take the medication more. So like go from every hour for 3 hours, then once every 2 hours, and then you get to about 3 times a day, like most supplements. Again, like your eating regimen, breakfast, lunch, dinner, take a supplement with it till the symptoms decrease. And again, if you have a lot of congestion, you're taking these decongestants, they do dry you out a little bit, even if they're herbal compounds. So Make sure that you drink lots of water with these. You want some movement if you're congested, because that helps flush out your lymph system. What also helps is heat. That increases blood flow and gets the lymph draining faster because it makes it more viscous. And then the last thing to try if you're having a sinus infection, allergies, is like our herbal ENT. This is an herbal antibiotic, actually. So if you're getting real flared up and you're starting to get tired now, it's tired, achy, soreness, more increased soreness in the face, going from mild to moderate, on the way to severe. If you ever had a sinus infection, you know what I'm talking about. Then we start taking the herbal ENT, again, on the hour, for about 2-3 hours, and then we'll start stretching out the time between the dosages, like 2-3 hours, then 3 to 4 as you get better. Again, drinking lots of water. This is a antibiotic type herbal remedy, so it can affect your stomach a little bit more, so you want to take your probiotics with it too. And this is good to like help you through that last part of the sinus infection. It's a strong herb. And then if you go through all that, if you take that course, usually you'll clear up. But if not, then it's time to go to your doctor. Then it's time to get the antibiotics and get checked out. But that's one way that you can take care of yourself naturally. And again, you can get any of those herbs in our office or contact me online. We got some of them in our shop at balancechiroMD.com. I am in the office today. We have a couple spots left here in the afternoon. I'll be here until 3. Our number is 701-893-7878. Once again, it's 701-893-7878. So if your neck hurts or your back hurts or you're having some allergy stuff going on, we can help you out. I do a little acupuncture for allergies also. And we'll just get you feeling better. So I hope you're having a great weekend. Yeah, and and we'll see you next time. Thanks for tuning in to episode number 2. Have a good day.